Hello friends, I'm here with my next video. Let's learn pharmacology. So friends, today I'm going to discuss on hypertension. So what is hypertension and what happens in hypertension we'll be discussing today. So first, hypertension, it is the most common cardiovascular disease affecting the worldwide population. What happens in hypertension is it is a persistent elevation of arterial blood pressure. We call it as hypertension. Simply remember it as high blood pressure is hypertension. High blood pressure. High blood pressure means high pressure will get exerted on the walls of the arteries which carries the blood from the heart to the body. We call it as hypertension. Normal blood pressure is it should be less than 120 by 80 mmHg. It should be less than 120 by 80 mmHg. Here comes the term blood pressure. What is blood pressure? It is simply a measurement of force applied on the arterial wall. We called it as blood pressure. Blood pressure is recorded as two numbers, that is systolic blood pressure and diastolic blood pressure. 120 is the systolic blood pressure, whereas 80 is the diastolic blood pressure. Systolic blood pressure. First, coming to systolic blood pressure, maximum pressure recorded during the ventricular systole. We call it as systolic blood pressure, that is the ventricular contraction. Next is the diastolic blood pressure, minimum pressure recorded during the ventricular diastole or ventricular relaxation. We call it as diastolic blood pressure. Systolic means contraction, diastolic means relaxation. Pulse pressure, difference between the systolic and the diastolic blood pressure, we called it as pulse pressure. Here we have a chart describing you the various stages of hypertension. First, normal. Normal systolic blood pressure should be less than 120, whereas diastolic should be less than 80. In pre-hypertension stage, systolic should be 120 to 139 and diastolic should be 80 to 89. In hypertension, we have two stages, stage 1 and stage 2. In stage 1, should be 140 to 159 and diastolic should be 90 to 99. And in stage 2, it should be greater than or equal to 160. Diastolic should be greater than or equal to 100. Next, coming to the etiology of hypertension. Hypertension could be primary hypertension or secondary hypertension. Here in primary hypertension, elevation in BP with no cause. And it is the most common type of primary hypertension. It is the most common type of hypertension. That is, primary hypertension is very common. Secondary hypertension, here elevation in BP is due to renal, vascular or endocrinal disorders. Next, coming to the causes. Causes of hypertension are multifactorial. They may be due to age, chances of coronary artery disease after 50 years of age, alcohol consumption, smoking, diabetes mellitus also are causes of hypertension, excessive dietary intake of sodium and caffeine. Gender, here males are more likely to get affected than females before 50 years of age. But after 50 years of age, females are more likely to get affected than the males because of menopause. Next is the abdominal obesity, especially the abdominal obesity is the cause of hypertension. Renal problems, that is kidney problems. Sedentary lifestyle, that is with no physical activity or exercise. We call it as sedentary lifestyle. Stress is also the cause of hypertension and many other diseases. Next, coming to the clinical features of hypertension. Sometimes high blood pressure does not cause any symptoms. Hence, it is also known as silent killer disease. Hypertension is also known as silent killer disease because it does not show any symptoms in patients with high blood pressure. And in some patients, it shows symptoms like irregular heartbeat, severe headache, blurred vision, dizziness, nausea, vomiting, fatigue, chest pain, and shortness of breath. Next is the diagnostic evaluation. The first step in the diagnostic evaluation is measurement of blood pressure. Next is the history collection and physical examination of the patient, medical history of diabetes mellitus, complete blood count, chest x-ray and ECG are required. Management of hypertension. Management of hypertension is possible by two ways, that is lifestyle modification and pharmacological therapy. So the patients with pre-hypertension stage or the patients who are at initial stages of hypertension, lifestyle modifications responds well. But the patients who does not respond well to the lifestyle modification at the initial stages, then we need to go with the drug therapies, and in those patients drug therapy is required along with the lifestyle modifications. So first, coming to the lifestyle modification, weight reduction in the obese patients. Being overweight or obese can increase your BP. Chances of increasing BP is more in obese patients, especially the abdominal obesity is the major cause of hypertension. Next is the dietary approaches to stop the hypertension. Limit the use of caffeine intake. In hypertensive patients, limit the use of caffeine intake. Next is the salt, reduce the sodium intake, that is reduce the salt intake. This is the first recommended any expert would make, because a low sodium diet is known to improve the symptoms of hypertension. But this is easy to say than to do, because sodium is hidden in many foods, right from the ketchup to every small thing like bread. So for this, we need to monitor the sodium salt intake we do every day and reduce the sodium intake. Limits the fatty food, eliminates the food that are high in saturated fat, such as processed food, full fat dairy products, fatty meats, that is red meat, that should be avoided in hypertensive patients. Add potassium rich foods. It is said that daily intake of 3000 to 3500 mg of potassium by hypertensive patient can reduces your blood pressure effectively. So increase your potassium intake by eating more bananas, tomatoes, spinach, broccoli, mushrooms. However, if you have any kidney problems or renal problems, avoid this intake and first consult with your doctor about the potassium intake. Next is the home remedies, such as garlic. Garlic can help to reduce the hypertension by increasing the amount of nitric oxide in the body. Nitric oxide helps you to helps to promote the vasodilation, that is the widening of arteries, to reduce the blood pressure. Fish is also very important. Fish is a great source of lean proteins. Fatty fish like salmon fish we have, they are very high in omega-3 fatty acids that can reduce the blood pressure. Next is reduce the alcohol consumption. Exercise, at least 30 minutes of walking is needed. Minimum 30 minutes of walking is required. Stress management. Stress is also a very important cause of hypertension. So try taking some deep breaths, meditations and yoga to avoid the stress. Not only for hypertension, it is for many diseases. Next we have is pharmacological therapy. Medications will help you to control the high blood pressure, and doctors will recommend you these medications. If your BP is particularly or constantly high, but medications alone does not work. Along with the medications or along with the pharmacological therapy, you need to do the lifestyle modifications also. So in next video, we'll be discussing on the pharmacological therapy of hypertension in detail. Thank you for watching my video. Please don't forget to like, share and subscribe to my channel. Thank you once again.